Do nothing strategy. What happens if you don't believe and do anything? What happens if you take a fatalistic view? Healthcare is going to go up. We're just going to pay for it. Well, I'll show you you're right. If you're going to pay for it, that's a do-nothing strategy, and you will be out of business, in my opinion. Or something's going to go in your district. Something has to go because there's only a fixed amount of resources. The natural flow. This is where I think all of us in this room are on that diagram someplace. This was developed in 1965 by John Travis. Been around for a long time. It's the simplest model that I can use. I've modified it quite a bit, but it stood this test of time. Everybody in Wisconsin, everybody in the United States, everybody in the world is on that diagram someplace. The good news is nobody in this room is on the left-hand side of that diagram. That's good news, physically. I don't know about the rest of it, but physically nobody's on the left side. Some of you hotshots think you're on the right side, and you probably are. About 10% of the people are probably on the right side. If you do a health risk appraisal, and you've all been offered health risk appraisals several times, we will tell you where you are on that diagram. On the left side, the middle, the right side. If you do 2 health risk appraisals, we will tell you which line you're on, the blue line or the red line. And if you do those in your district, then we can say how you're doing. We take the sum of the blues and the sum of the reds and put them together, and hopefully the blues outnumber the reds, and the length of the blue lines are greater than the length of the red lines. Now, if you had a choice, where would you want to be? Which line? Red line or blue line? Now, blue, say it. Blue. Go blue. So you have a choice. Who's in charge of that choice? I will say this a couple times throughout the whole session, because I want you to understand that you're in charge. And it's your responsibility to do something about your own life. All right. This is what I call the baseline for WEA. We had the opportunity in 2002 to look at WEA Trust members with health risk appraisals. It's before you had a lot of programs going on. So this is what I call the baseline. And we put people into 3 categories. A low risk category, you had 0, 1, or 2 risk factors. A medium risk category, 3 or 4 risk factors. And a high risk category of 5 or more factors. So those are the 3 ways that we strategize or stratify a population. And every population we worked with has been like this. So at time 1, it's time in 2002, the baseline numbers, 51% of the population who took health risk appraisals were low risk. 38% were medium risk, and 10% were high risk. That's at time 1. So that's the baseline. Then we come back a year later and look at the population. Now these are the same people this time. They had to take a health risk appraisal both years. A year later, now 48% are low risk, 40% medium risk, and 11% high risk. That's just 1 year. So that's interesting, but doesn't tell the whole story. Look at the people who were low risk in time 1 and low risk in time 2. Low risk in 2002, low risk in 2008. 69%, 70% of the population stayed low risk. Those are your champions. Those are the people that are doing something that is staying low risk, and they are helping you. They're your champions. What are you doing for your champions? What are you doing for them? Do you recognize them? That's how they'll stay there. As I go through the rest of this talk, you will get the idea. My bias is that's the core business you're in, maintaining your low-risk population. On the private side, I call it market share, but the idea is how do you keep those people low risk? 58% of the high-risk people stayed high risk. They were high risk at time 1, they were high risk at time 2. They're just doing what they do. And then 61% the medium risk stay medium risk. The good news is some people are coming down from high risk to medium, medium to low, high to low. That's good. But on the other hand, people are going the other way. So that's the natural flow. That's the churn in the population. Every population is like that. You got to get to the root cause. Then the root cause are risk factors. Risk factors drive disease. You might say, well, what drives disease? What drives costs in our organization? People will say a lot of things. One of them will be sickness, illness. I say, well, that's a trivial question. What is it that drives disease? And that's the risk factors. So that's why I spend a lot of time on risk factors. Because risk factors are the core that drive your healthcare costs. How are you going to control that? What are you going to do? What are you doing in your organization to control risk factors? My advice is don't worry about trying to control costs. It doesn't work. We've tried it. Try something new. The next generation will not be looking at controlling costs by controlling costs. They'll be looking at controlling costs by controlling risk factors. Or just look at the diagram. You find the only way to get to a high level of low-risk people is stop the upward flow. Let's look at healthcare costs. Now that may be on your minds. It's on everyone's minds. There's not a group I talk about in this country that says we cannot sustain a business the way healthcare is going. So what is the net? If you do nothing, here's what will happen. And this again, WEA measures in 2002. Low-risk population, low-cost population, less than $1,000. 37% of the population is less than $1,000. So most populations, some of your districts will be a little different than others, but in general, you're going to have 30 to 40% low cost. 23% are high cost, that's more than $5,000. And then 40% are medium costs. So that's time one. Time two, you'll see you're going from 37 to 35% low cost. It's the same flow as at the risk, and 22 to 25% high cost. And some of the people are staying low cost over time. Other people are coming down, and other people are going up. So that's the natural flow of healthcare costs. Now, can you live with that? Well, what I'm finding, companies cannot live with that. We have one of our groups, Kiowa Community College. They say their healthcare costs are going up so much that they have to add 500 students every year to make this work. They've only been averaging 200 students. It's not sustainable. This is not sustainable. You can't sell enough product. You can't raise taxes enough to cover healthcare costs. So you can either try to do it, or you can find another way to do health management. And I feel very strongly that I think that WEA Trust is finding a way to make that help you on that, because this is a natural flow. But we'll talk more about that as we go. Here's another look at natural flow. Everyone in this room is on one of those three lines. Which line you want to be on? Let me tell you how we got those lines. You know, we have 2 million people in our computer system. We searched our computer system over a 10-year period, and in any one 3-month period, did we find someone with more than $5,000 of healthcare costs. If we found them, we put them on the yellow line right in the middle and call that the 0 quarter. And we go back 12 quarters in our database and forward 12 quarters in our database, and that's the natural flow of a heart attack or a serious health problem. The green line is if we found somebody between 500 and 5,000, we put them on the green line and constructed the curve the same way. The red line is not even $500 in one quarter. And we went 12 quarters each way. We just picked a midpoint. So the three lines. Each of you are on one of those lines. I guarantee you. Where do you want to be? Which line? In this case, go red, because that's the best place to be, clearly. Now, who's in charge? Which line you're on? You all come up with the idea, same answer. I am in charge. Me. As soon as you say that, we've got you, because that's all we have to teach. If WEA Trust can teach that, we will all win. Self-responsibility. That's all we have to teach. And then you have to believe it. You have to act on it. Because that's the natural flow. If you do nothing, that will happen. Well, look at the natural flow of risk and costs. Here's a diagram that we've published from every company. We see the same thing. On the ordinate are the annual medical costs. Across the abscissa are the age groups. And along the z-axis are low risk, non-participant, medium risk, and high risk. Here's the cost of the low risk people. This is cross-sectional data over time. So you see what the costs are, and the costs go up with age in this country. And then it comes down at 65 because of Medicare. So one of the strategies in most companies and so forth is just get people to 65 and then throw them off to the government. So there's the people you don't know the risk factors. Here's the medium risk people. Here's the high risk people. Without changing your age, which bar you want to be on? I think everybody gets it. And who's in charge? So you have your choice. Your whole district, all the members that you cover, all the lives you cover on one of those bars. As they age, as they change age groups, where do you want to drive them? You have an opportunity to drive them where you want to drive them. With benefits, with health promotion, wellness programs, a lot of incentives you can use to drive people where you want. Typically, you want to drive into the blue lines. So there are three things to learn in this chart without getting a PhD. Number one, don't get old. Because regardless of your risk factors, as you age, costs go up. Number two, within any one age group, as risks go up, costs go up. And the third thing to learn, and why I think wellness, health promotion, health management programs will work, and I think they're the solution. They're the solution to the do-nothing strategy. The solution is that, say that you are any age, say for example 45 to 54, and you're on the yellow line. That means you have 3 or 4 risk factors. As you go to the next age group, where can you go? You can go to the red line and look at the costs. You can go to the yellow line, and it just goes up because you didn't change risk factors, or you still remain 3, or you can move to the blue line. And you have it in the power of your organization to create the incentives and the programs to help people drive to where they want to be. Anybody who understands this is not going to go to the red line. They don't want to be on the red line. Maybe it's because they don't know the consequences of their actions. But you have an opportunity to do something for them. So if you're willing to accept the consequences, then you're done. If you want to see some other alternatives to consequences, then let's go forward.